Committee has now been called to order. We do have a quorum, so we'll go ahead and get started as people filter on in. Let's wait about 10, 15 minutes after the first presentation to call the roll. Just don't let me forget. So here's the agenda. A long time ago, we planned to have the Alzheimer's Association, the Desert Southwest chapter, come in and present. So we're going to start with them for the first 10 or 15 minutes. They're going to share some information with us. Then we'll start hearing bills. We'll hear HB2202, and then we'll move into our two midwives bills, 2251 and 2252. Then we'll take a 10-minute recess, we'll reset, come back, and then we'll go into the Medicaid, SNAP, and the Rural Health Transformation Fund bills. So a reminder, when the bills do come up after the first presentation, that it's 2 minutes limited to speaker, followed by Q&A, and then up to three can testify in support of a bill, 3 opposed. I understand there is overflow, so if someone wants to sit down, we do have an overflow room next door in hearing room 5. So with that, let's go ahead and get started with the Alzheimer's Association Desert Southwest chapter. We have Terry Spitz, the chapter executive, and Dr. Anna Burke presenting from Barrow's Neurological Institute. So do start again with your own introduction, and we'll see the slides, and we'll get going. Thank you for being in committee.
Thank you. Thank you, Madam Chair and committee members. First, I want to thank all of you for making Alzheimer's and dementia a priority in our state. As our aging community grows, and more people are going into that retirement age, and in their 50s and 60s and 70s, we're seeing more and more cases, we're seeing more and more caregivers, but there's a lot of hope. We have a lot of programs, education, treatments, a lot of things out there that can really help people and help families. So what you're going to hear today is some research, some hope, what the diagnosis part, all of that. I'm joined today with Dr. Anna Burke from Barrow Neurological Institute to kind of give you a look at what's going on in our state and just some of the hope around what the disease looks like right now. Thank you.
Thank you. Thank you for inviting me today. I'm Dr. Anna Burke. I'm the director of the Alzheimer's and Memory Disorders Division at Barrow Neurological Institute. I'm a clinician and a researcher who has been in this fight for well over 20 years now. Arizona is actually one of the unique places where research and care is being transformed for patients suffering from Alzheimer's disease. And it's really because of the support of advocates like you, like the Alzheimer's Association. We know that Alzheimer's disease and related dementias are truly one of the greatest challenges facing our society currently. You can see here our world is aging. In the United States alone, we estimate that we have about 7 million Americans who are currently suffering from Alzheimer's disease. And those numbers are increasing. By 2050, we anticipate we will have anywhere from 15 to 16 million Americans struggling with this disease. And some say that those are severe underestimates. I can tell you, in this country, we diagnose a person with Alzheimer's disease every minute. That tremendously changes their life, as well as the life of all those who are involved in their care, their families, their loved ones, and the community as a whole. Even though we talk about breast cancer and prostate cancer, you hear about them on the news and how much of a scourge that is. If you combine the deaths from breast cancer and prostate cancer, more people still die of Alzheimer's disease every single year. That's how impactful this is. In Arizona, we have about 150,000 Arizonans who are struggling with this disease. Now, these are just the people who are diagnosed. Imagine the impact. Every person has multiple family members who are being affected by this, who are having to take time off work, who are struggling with just figuring out, how do I care for mom, dad, my sister, my brother, my parent? And unfortunately, they are not receiving the diagnosis that is necessary. Only a small number of patients actually receive a timely diagnosis. Even though we know Alzheimer's disease accounts for 70% of all dementias, only about 25% of Alzheimer's disease is actually diagnosed. And when it comes to management of this disease, it is abysmal. We know that certain medications, for instance, can make the disease worse, can speed up the disease process. Yet physicians only review medications in about 10% of cases. Caregiver supports are provided to less than a third of families who are struggling with this disease. And oftentimes patients are not being referred to specialists or provided care until their symptoms can no longer be ignored. We know that this results in horrible care for these patients. About 20% of hospital admissions are actually preventable in dementia. The top 10% of Medicare beneficiaries with Alzheimer's or related dementias account for 50% of total healthcare expenditures and a third of all drug expenditures. They have increasing mortality rates, increased risk of institutionalization, and so on. Why are they struggling with this disease so much and receiving an adequate diagnosis? Well, it comes back to education. I can tell you I'm an educator as well. I'm a professor at all of our medical schools here in Arizona. Do you know how much education a medical student receives in dementia? Over the course of their 4-year training, they have about 2 weeks of training in dementia care. A primary care physician, a family medicine physician, out of the 3 years of specialty practice that they have, training after medical school, they rotate through at our service with a dementia specialist for a month. That's the only training that they get in dementia. So no wonder they are not diagnosing patients, not providing proper care. They don't feel comfortable. They don't have the tools, the skills, the confidence, the competence. And that means they are afraid to open up Pandora's box. They are waiting until they can't ignore those symptoms anymore. And that means that those patients are not getting care. Couple that with the fact that we do not have enough specialists in this country. If you combine all of the specialists like myself around the country, we are able to cover about 10% of the people that need us, care for them. That means the primary care physicians, the family medicine physicians will have to take over the burden of caring for these patients. The average wait time to see a specialist ranges from 3 to 12 months. And we know that time is brain. I can show you here a scan of the brain showing the neuronal death, essentially, that occurs over 18 months. Everything that you see in blue and red, those are active brain cells. Those are healthy brain cells. Everything that's gray, that's basically damage to the brain. And you can see what happens over 18 months. So if a patient is waiting for a year, that truly impacts the care that they're going to have and their outcomes. There are many treatments that have become available, not just medications, but lifestyle modifications. We know that management of medical conditions at an early stage has a huge impact on how quickly symptoms progress. There's a great deal of research being done, including in Arizona. We are actually leading the country as far as research in Alzheimer's disease through the Arizona Alzheimer's Consortium, which, by the way, you graciously fund. And then caregiver supports. We are also leading the way as far as development of caregiver supports. Because of the Alzheimer's Association and the research that has been done with the funding from the Alzheimer's Association, we now know through studies like the U.S. Pointer study that lifestyle modifications, diet, exercise, cognitive stimulation, proper sleep, all of that can actually slow down the disease process. We just need to be able to implement that, and we need the primary care physicians and other physicians to take notice. We have a brain health recipe now that we can actually provide to patients, incorporating all of these factors. We have new therapies, the amyloid targeting therapies. You may have heard about these. These are actually medications that can get into the brain, dissolve amyloid plaque, slow the disease process by 30%. 30% more time functioning, thinking, enjoying time with your family, but they're only effective in early stages of the disease before the damage is done. So this is where early diagnosis becomes critical. And we have drugs in the pipeline. We have therapies, neuromodulation in the pipeline. There are currently over 140 different agents being studied, much of these in Arizona, over 180 different clinical trials. So the hope is there. And again, our Arizona Alzheimer's Consortium is leading the way. Barrow is part of that consortium, but you can see we have incredible partners. And every year we are grateful to have the support of the legislature to fund the research into understanding the disease process and developing new therapeutics, new supports. So we can make a difference, but access to early diagnosis and treatment and research is really going to lead the way. We need your support in order to be able to do so. We have amazing researchers here. We are leading the way as far as comprehensive diagnosis, management, and education for patients and families struggling with this disease. And we hope in the near future that we will be standing in front of you talking about the first patient, the first survivor of Alzheimer's disease, and that we will be able to end this disease. So thank you for your time. Thank you for your support.
Thank you, Dr. Burke. Members, are there? Yeah, let's give her a round of applause. Thank you. Yeah. Any questions or discussions from the members? I just have to say I am very impressed on the statistics as well as the therapies. I see optimism for the first time. Questions or comments or discussion? Seeing none, thank you. All right, let's go into the business portion of this meeting, this committee meeting. So, Jaden, let's hear you explain House Bill 2202. Oh, let's do roll. Thank you. That good reminder. We were waiting till everybody filtered in. So now we'll do roll call.
Okay. Representative Contreras.
Present.
Representative Gress.
Here.
Representative Hernandez.
Here.
Representative Cupper.
Here.
Representative Ligori. Representative Lopez.
Here.
Representative Luna Nahara.
Here.
Representative Mathis.
Here.
Representative Pingarelli.
Here.
Representative Winiger.
Here.
Vice Chairman Heap.
Here.
Chairwoman Bliss.
Here. All right, now, Jaden, please explain House Bill 2202.
Madam Chairman, members, House Bill 2202 appropriates $300,000 from the State General Fund to the Department of Health Services in fiscal year 2027 through 2029. It focuses on providing a grant to implement a dementia care telemonitoring program to disseminate information regarding dementia care and best practices to healthcare providers statewide. The Department of Health Services is responsible for publishing an annual summary report on their public website. With that, I'm available for questions.
Members, any questions for Jaden? All right. Well, as a sponsor of the bill, I'll give a brief overview and then pass it off to our speakers. Basically, this bill will appropriate $300,000 over 3 years for a dementia care telementoring grant program. Now, this comes from the general fund, but the idea here is to put it in the budget box where it can be then negotiated. If we don't pass this out of committee, it will never stand a chance. So what we're doing here today is just putting it in the budget box so it has a chance to go forward. I just want to emphasize the grant program is intended to train healthcare providers statewide on best practices in diagnosing and caring for patients with dementia. And with that, I'll pass it off to our speakers.
First speaker, Tony Roberg.
Thank you. Ooh. Good afternoon, Madam Chair and members. For the record, my name is Tori Roberg. I am the Arizona Government Affairs Director for the Alzheimer's Association. We're here in support of House Bill 2202. The Alzheimer's Association leads the way to end Alzheimer's and all other dementias by accelerating global research, driving risk reduction, and maximizing quality care and support. Thank you, Madam Chair, for sponsoring this important legislation. Arizona is a rapidly growing state, and Arizona has one of the fastest growth rates of Alzheimer's in the country. Clinicians are telling us they need more support. 82% of primary care physicians say they do not feel comfortable making a dementia diagnosis. 39% report shortages of dementia specialists in their communities, and 65% say their residency training included very little dementia education. These are not just small gaps, they are barriers to early detection and diagnosis of dementia. This bill provides a solution to close these knowledge gaps. Nearly 4 in 5 Americans say they would want to know if they had Alzheimer's before symptoms interfere with their daily lives. House Bill 2202 empowers clinicians to honor that preference, helping them detect cognitive issues earlier, counsel families sooner, and connect patients with treatments and supports that can improve quality of life. I'd like to give you an example of how this program has worked in another state. So, since 2020, a similar telemetry program in Washington State has engaged 289 providers across 250 zip codes, produced 42% gains in provider knowledge and 53% gains in confidence, and led 83% of participants to report expanded access to best practice dementia care for the patients they serve. This is currently run through the University of Washington's Neurology Department as part of a Project ECHO for dementia. This is the kind of transformation Arizona families also deserve, and there is real hope here. By giving clinicians the tools to spot dementia earlier and guide families with confidence, we can help people living with dementia to have more time with their loved ones, more time to plan for what's coming, and our health systems will have more tools to give families the support they need. I urge you to vote yes on House Bill 2202 today. It is a smart, modest proposal that will genuinely make a difference for families in every corner of Arizona. With that, Madam Chair, I'm happy to answer your questions.
Members, any questions? Thank you, Ms. Roberg. I appreciate that. All right, Vice Chair, next speaker.
Dr. Danny Cabral.
Good afternoon, Madam Chair. Thank you for sponsoring this bill, Representative Bliss, and thank you, members of the committee. I'm Dr. Danny Cabral. I'm an Alzheimer's specialist, neurologist, and psychiatrist. I have a private practice in Phoenix, caring for patients and care partners. So, Dr. Anna Burt gave a fantastic presentation. She's a mentor, friend, and hair role model. So there are 150,000 Arizonans with Alzheimer's and related diseases. There are 240,000 care partners in Arizona caring for them, millions of unpaid hours of care. $600 million is the Arizona cost that Medicaid is reporting for last year for these diagnoses. And so we know that most of this care is in primary care because we don't have enough specialists to go around. And so what happens because of this lack of training and confidence? There's underdiagnosis. So many of you probably in the room have someone close to you who's going through these diseases. They are undiagnosed half the time for their whole life. They're never diagnosed, so that means they're never given proper treatment and resources. As well, people who are in the early stages who can access these new, much more effective treatments, care, and support, 90% remain undiagnosed. As you heard, there's limited training for all healthcare professionals, not just physicians. So a 2020 survey by the Alzheimer's Association found that primary care medical residents only get about 8 hours of training. And then we heard from Dr. Burke that 50% of healthcare dollars, 1/3 of medication costs are due to these diseases. So as well, you heard that Arizona, this time to wait to see a specialist who's going to give you this comprehensive care. A RAND report from last year showed that Arizona, the time to see a specialist in the next 20 years is projected to be 57 to 62 months. So nearly 5 years to see a memory specialist. So this is going to affect all of us, and especially those in midlife in the room. There is hope. There's no longer this, there's nothing we can do, it's a foregone conclusion, everything goes downhill. There's so much we can do. But right now, because of the lack of training and support and community for healthcare professionals, by the time families are seen by specialists, symptoms have progressed, care needs and costs have increased, crises are imminent or already happening. Care partner stress and burden is extreme, and as we know, care partners often die before the person who has the disease. More hospitalizations,
Looks
care
like
expectations.
our 2 minutes are up, I'm sorry.
Oh, sure. Well,
I'm learning
thank
so
you
much,
for,
yes.
Thank you for, and the ECHO programs we know in the country
ECHO
and
program.
around the world
There
have
you go.
improved
Members, any
outcomes. Thank you.
questions? Fabulous, thank you
Thank
so
you.
much. Vice Chair, our next speaker.
Bob Ehlers.
2 minutes goes so fast. Welcome to committee.
Madam Chair and members of the committee, my name's Bob Ehlers, and I live in Litchfield Park. 5 years ago, when I was 58, I got diagnosed with Alzheimer's disease. I was working as a vice president for a semiconductor software company, and I started to have memory lapses and other cognitive issues. With a family history of Alzheimer's disease, I knew I needed to get tested. But I also wanted a way to maintain control of that test information, so I entered into a clinical trial. That clinical trial was for the drug that they were just talking about, lecanemab. In order to be accepted into the trial, I got a bunch of tests, amyloid PET scans and blood tests and DNA tests and all sorts of things. A couple of weeks after I got tested, the intake coordinator called me, said, "Congratulations, you've qualified for the trial, and my sincere condolences. You better get your affairs in order." So I was not too happy. That kind of hit me like a bus. My wife and I and our lives were turned upside down. My family started to mourn me while I'm alive. However, at that point, I became empowered to take control of my own destiny. I continued with the clinical trial, and that led to FDA approvals, not only the trial drug, but diagnosis and treatments and the reduction of the cost of those treatments. I made changes to my diet and exercise and other lifestyle changes, and these slowed the deterioration of my mind. With the diagnosis, I was able to develop work accommodations with my employer. They were great. I prepared for my finances and legal documents, and after researching long-term care options, employment options for my wife, cost of living, and medical ecosystems, we decided to move to Arizona, and that's been the greatest thing that we could have possibly done. 2 years ago, I retired on disability, but I have good prospects because I know what to expect. The diagnosis of Alzheimer's disease was devastating, but it allowed me to maintain control of my life, and at least for the time being. I was lucky. Not everyone can be in a clinical trial. I asked the committee to vote yes on Chairwoman Bliss's House Bill 2202 because early detection and timely diagnosis from a physician is super important. And you can do something about it, right? And I'm proof of that. I'm 5 years in, and they told me I was going to be dead. Any questions?
Members, any questions? Mr. Ehlers, I just want to say thank you for making this a reality and sharing your lived experience. You are making a difference. All right, seeing none. Mr. Vice, yeah. That's good. Mr. Vice Chair, has anyone signed in to speak against this bill?
No.
All right, no further speakers, no further discussion. Mr. Vice Chair, please move House Bill 2202.
Madam Chair, I move that House Bill 2202 be returned with a due pass recommendation.
Members, the motion before you is House Bill 2202 be returned with a due pass recommendation. Secretary, please call the roll.
Representative Contreras.
Madam Chair,
Please.
thank you. Thank you to everyone for coming today, and thank you for those who testified, and Mr. Ehlers. We wish you all the best in your journey. Having worked in a nursing care facility with a dementia care unit many years ago, and also starting to help the process of designating Phoenix a dementia-friendly city a few years ago, I recognize the importance of early detection and diagnosis. This disease needs more providers. We heard that today for sure. But until that happens, I enthusiastically support this telementoring program and vote yes. Thank you.
Representative Gress.
Aye.
Representative Hernandez.
Aye.
Representative Cupper.
Aye.
Representative Legori. Representative Lopez.
Aye.
Representative Luna Nahara.
Madam Chair,
Please.
thank you. I also want to echo just everybody who is here supporting this legislation. Mr. Ehlers, thank you for sharing how it's impacted your life. As somebody who is living with somebody with Alzheimer's, I know how important it is to get the early detection. I also hope that in the future we could start seeing a little bit more wraparound services, especially in northern Arizona, where we have a lot of disparity in healthcare. And so I'm hoping that we can start tackling more of these issues that impact our families and those suffering from this disease. And I vote yes.
Representative Mathis.
Aye.
Representative Pingerelli.
Aye.
Representative Winiger.
Aye.
Vice Chairman Heap.
Aye.
Chairwoman Bliss.
Aye. Members, by your vote of 11 ayes, 0 nays, 0 present, and 1 absent, you've given House Bill 2202 a due pass recommendation. All right, good job, you guys.